G'day, hello, I'm Lorraine Glendenning. I am Irish and Canadian. I live on Mi'kmaq territory on the eastern shore of Nova Scotia. I'm going to read the section of the TRC report entitled Offenders with FASD. There is another link between the substance abuse that has plagued many residential school survivors and the over-incarceration of Aboriginal people. Fetal alcohol spectrum disorder, FASD, is a permanent brain injury caused when a woman's consumption of alcohol during pregnancy affects her fetus. The disabilities associated with FASD include memory impairments, problems with judgment and abstract reasoning, and poor adaptive functioning. It is a debilitative cognitive impairment, which children must live with for the rest of their lives, through no fault of their own. A study done for the Aboriginal Healing Foundation drew links among the intergenerational trauma of residential schools, alcohol addictions, and FASD. The study concluded that the residential school system contributed to the central risk factor involved, substance abuse, but also to factors shown to be linked to alcohol abuse, such as child and adult physical, emotional, and sexual abuse, mental health problems, and family dysfunction. About 1% of Canadian children are born with some form of disability related to prenatal alcohol consumption. But estimates from Canada and the United States suggest that 15 to 20% of prisoners have FASD. A recent Canadian study found that offenders with FASD had much higher rates of criminal involvement than those without FASD, including more juvenile and adult convictions. The Commission believes there is a need to take urgent measures both to prevent FASD and to better manage its harmful consequences. There is a clear need in Aboriginal communities for more programming that addresses the problems of addiction and FASD. Call to action. 33. We call upon the federal, provincial and territorial governments to recognise as a high priority the need to address and prevent fetal alcohol spectrum disorder, FASD, and to develop, in collaboration with Aboriginal people, FASD preventive programs that can be delivered in a culturally appropriate manner. It is challenging for courts to deal with offenders with FASD because obtaining an official diagnosis entails a long and costly process of multidisciplinary referrals. Even if trial judges have been educated about the symptoms of FASD, they are generally unable to take notice of FASD without evidence of a diagnosis. Clearly, better diagnostic tools are needed, accompanied by sufficient resources for intensive community programs as realistic alternatives to jail and as support for people living with FASD to avoid repeated conflicts with the law. The recent enactment of mandatory minimum sentences for some offences further complicates the situation of offenders with FASD because it denies judges the flexibility to consider individual circumstances in their sentencing. There is a danger that prison will be used unnecessarily as another expensive crisis intervention for Aboriginal offenders with FASD, even though culturally appropriate supports in the community could often be a more appropriate approach. As well as amending mandatory minimum sentencing laws, the federal government can do much more to tailor correctional and parole resources to facilitate the reintegration of offenders with FASD into their communities. Call to action. 34. We call upon the governments of Canada, the provinces and territories to undertake reforms to the criminal justice system to better address the needs of offenders with fetal alcohol spectrum disorder, FASD, including 1. providing increased community resources and powers for courts to ensure that FASD is properly diagnosed and that appropriate community supports are in place for those with FASD. 2. Enacting statutory exemptions from mandatory minimum sentences of imprisonment for offenders affected by FASD. 3. Providing community, correctional and parole resources to maximise the ability of people with FASD to live in the community. 4. Adopting appropriate evaluation mechanisms to measure the effectiveness of such programmes and ensure community safety.